Greetings once again. Well, I've been away the past week, which I'll tell you a bit more about in the next podcast. This podcast, I'm afraid, might not be easy listening. You're not reading it, are you? Over the past few weeks, I've noticed a few things about my body that are starting to change. I'm starting to get weaker. I'm starting to feel uncomfortable around my abdomen. I know that with liver cancer, it's a very quick deterioration. I can be up and about and seemingly fine, and then within days come crashing down. The liver is an extraordinary organ, as most organs are, but this one has a particularly amazing way of being able to function on almost less than 10% of its ability, if you know what I mean. It can continue going and continue going, even when there's only 10% of it actually functional. Less than. But once that 10% starts deteriorating, then so does the rest of me. So these little things that I'm starting to feel may just be my mind, just be my imagination. I had cystitis the other week. Actually, up until recently, I was placed on some antibiotics. You know that those of you who've had cystitis, you know that awful burning sensation when you go to wee, and I actually bled when I weed. Like I said in other podcasts, I've got ESPL in my urine anyway, so things like cystitis and UTIs and things like that are going to be par for the course, because I've got this little buglet inside my bladder, inside my urine. Well, you tell me what it's about, you're the medical people. But it's going to, if I'm particularly low, as my immune system deteriorates with this chemotherapy treatment, then I'm going to be susceptible to all sorts going on. I start my next lot of chemo this week. I've had a break over this past week or so. So maybe that's made a difference to the way I'm feeling. I don't know. How do I know? How does anyone know? But it's you nurses that have got to start knowing, and you doctors that have got to start knowing as well. Because this is how it is. This is the reality of cancer. Not the theories, not the books, not the theorems. This is the human side. This is the scared side. This is the angry side. This is the side that hurts physically and gets confused. Even with my medical knowledge, such as it is. I was a rehab nurse for a great deal of my practice. Both as a nurse and as a carer. I worked a lot more in rehab, seeing people reach their potential, which, as you've gathered, is my absolute passion, is to see people reach their absolute potential, to follow their dreams and to actually achieve them. That is another bit that's coming in the next podcast. So, when it comes to the actual nitty-gritty of illnesses, and particularly when it comes to palliative side of nursing. I have a loving, dear, precious, priceless friend called Jackie Petley, who is so gifted in palliative care, both in talking to the patient, that's me, and my family. I have been incredibly humbled by some of the girls at my work, the carers. My darling Sheila, my wonderful Marina, Trish, Janice, Sarah, Jenny, Anna, all of them were willing to come and nurse me. All of them willing to be there for me. And I only worked there 18 months in total. My amazing boss, Alison, Charlotte. But particularly Jackie. And my darling friend Claire Stewart. One is a midwife, so she deals with the other end of life. The other, as I said, has worked in palliative care. She's seen the reality of what it is for someone to start feeling the beginnings of the end. I've still got some fight in me yet. I just got back off the cruise and I need to crack on with the patient association work. I need to start working a bit more on the estate. Because let's face it, to some extent, not all the extent, but when it comes to our church, who else will? There it is, I've said it. With the exception of some of the leadership, i.e. James and Neil. That's another subject altogether. Right now I'm scared. Right now my body feels like it's starting to give up. And there's still so much to do. Please, God, give me the peace to cope with this. Thanks for listening. Sorry for the